Hello, this is my presentation on why I feel like the war on drugs should end. My thesis statement is, the war on drugs need to end because the current laws are not set up to help the addict find recovery. It is ruining relationships between police and citizens, and the mass incarceration of drug offenders is devastating communities. So I'm going to hit on each topic. I have some pictures here just that I wanted to add in to kind of describe, what my topic is about. Some background information. In 1971, President Nixon declared war on drugs to reduce the illegal drug trade and initiate drug policies intended to discourage the production, distribution, and consumption of illegal drugs. Congress then passed laws in 1986 to establish mandatory minimums for various drug crimes. All of the laws combined have created the harsh sentences and lack of support that is prominent today. Candace McCoy says, since 1971, the U.S. has spent $1.5 trillion to wage the so-called war on drugs, yet the rates of drug use remain stable. Another disturbing topic is the increased incarceration rate of drug offenders. The United States is home to less than 5% of the world's population, but nearly 25% of the world's prisoners. So some background information continues. Portugal may have the answer that our country needs. In 2001, Portugal decriminalized all personal use and possession of illicit drugs. With the new policy in place, the death rate from overdose has plummeted 5 times lower than the European average. The HIV infection rate has dropped from 104.2 new cases per million in the year of 2000 to all the way down to 4.2 cases per million in the year 2015. In 2015, a study found that since the drug reform has taken effect, the per capita percentage of drug uses has decreased by 18%. In that same study, the Drug Policy Alliance they found that the number of people in prison for drug-related offenses fell from 44% in 1999 to just 24% in 2013. So it cut that incarceration rate in half. And finally, with the background information, with the policy changes that have happened in Portugal, if a person gets caught with a personal amount of drugs, they are sent to a local commission that's usually consisting of doctors and social workers, where they learn about the treatment and valuable resources that are there to help them find addiction. The evidence that is provided from Portugal shows that drug law reform can not only save lives, but it can also lead to a decrease in public disorder, reduce the HIV and hepatitis transmission rate, and prevent overcrowding in prisons. So I'm going to start going over the topics of why I think the war on drugs should end. So first of all, reform must happen on our current drug laws. The view of harsh punishments for drug-related offenses is outdated and ineffective. Looking at the factors that stimulate addiction can help create a lasting solution that doesn't require jail or direct supervision from a government entity. Homelessness, lack of education, no health care, behavioral issues can all lead to addiction. Tessie Castillo from The Progressive says, an effective drug policy would seek to reduce the exposure to all environmental factors that create the risk of substance abuse. Castillo also says, under the current system, an offender can be jailed, deported, evicted, lose custody of their children, or even lose their employment due to a conviction. Finding ways to address the social and economic issues for the offender will help them create a stable starting point instead of the uprooting that takes place with incarceration. Free healthcare, along with a living wage, free higher education, and affordable housing can all play a critical role in building up the communities devastated by drug addiction. So I have here an opposing viewpoint that I wanted to share. Some critics say that without the threat of jail or prison, people would increase their drug consumption. Dr. Robert DuPont from the Rivermont Health says, more supply means more drug use. Drug legalization enhances drug supply, and it will reduce social disapproval of drugs. The legalization of any drugs is taking a risk without fully knowing the consequences. All illegal substances produce intense brain reward chemicals that the user values highly. So highly that they are willing to pay a ridiculous price or suffer the negative consequences to get it. So to counter that argument, I say, despite what critics say, there is not sufficient evidence to clearly show that drug uses will rise if drugs become decriminalized. There is a possibility that drug uses may increase if decriminalization happens, but that is not the area that we should be focused on. What we should focus on is looking at what changes can be made to help the addict find the help they need. Addicts are needlessly being thrown in jail, convicted, and thrown back on the streets without any chance of rehabilitation. Merely banning illegal substances is not sufficient in fighting against this terrible disorder. The harsh policies that have been in effect for nearly 50 years, and there has been no improvement rate in the rates of addiction and overdose. Another important aspect of ending the war on drugs is the relation between police and citizens. When police must enforce minor drug possession laws and other drug-related offenses, it creates violence and hatred between citizens and the police that are sworn to protect them. Shootings, riot, and raids sweep through communities, and citizens begin to resent their police force. When politicians constantly pass laws into effect that prevent the consumption of drugs, it allows judges to rubber stamp search and arrest warrants, and then police have to carry out those arrest orders. This creates a never-ending cycle, keeping the addict in the criminal justice system. That quote was from Jacob Sullum, who's the author of Drug Prohibition Turns Police into the Enemy. Jacob also says, not only do the current laws promote a separation between police and the members of the community, but it also is a complete waste of police resources. It is time to put a stop to ineffective drug policies and move toward a new progressive way of treating drug offenders. So another opposing viewpoint is opposers of drug reform believe that addiction is not a victimless crime, and those who are addicted need to be prosecuted as harshly as possible. Former prosecutor Dan Alsobrook says, the popular statement that drug abuse is a victimless crime is a myth. It can affect the lives and children and adults nationwide. The victims of drug abuse range from those physically harmed by drug-induced crimes to the taxpayers who are footing the bill for drug treatment. In other words, every citizen is a victim either directly or indirectly. Mr. Alsobrooks then goes on to say that crimes related to substance abuse range far beyond possession. They run from environmental pollution to a murder. Crimes include gang wars to control the drug trade, methamphetamine manufacturing sites that are a biohazard, and deaths that are caused by drug-impaired drivers. All of this plays into the bigger picture that drugs should remain illegal. So, to counter that argument, I say, despite what opposers want people to believe about drug addiction causing many victims, that is still a misplaced focus. It is true, addiction may cause many victims, but right now, addicts are stuck in a never-ending cycle of becoming addicted, breaking laws to fuel their addiction, getting into legal trouble, and then back out into society with no help to treat their addiction. There needs to be a fundamental change with how we treat addicts in the criminal justice system. Once this change happens, it could lead to lower rates of people addicted, and then we could see a decrease in the victims that are affected by drug addiction. That should be the goal, to decrease the amount of people plagued with addiction by getting to the source of the problem. So the last topic is one final aspect of reforming our current drug laws is incarceration. Right now, we see a vicious cycle of using drugs, committing crimes, entering the criminal justice system, and being released back out into society, and potentially committing crimes again. The recidivism rate for drug offenders is around 68%. According to a study done by Stephen Belinko in 2018, he found that only 9 to 20% of offenders get the option for treatment in lieu of being sent to jail. Programs like behavioral treatment centers, medication assistance therapy like naltrexone, and outpatient treatment services should always be a preference over incarceration. Karadansky says, we need intervention programs that cut out the criminal justice middleman and connect people directly with the treatment and services that can actually help them get sober. Addiction should no longer be considered a crime, but a mental health disorder. By not treating the drug abuser's mental health needs, it becomes a missed opportunity to improve both the health and the safety of the public. So in conclusion, I want to say, let us seek to finally end the war on drugs. We need to move toward a more progressive way of handling addiction. Jailing and fining offenders is no longer sufficient. People who are suffering from substance abuse disorder need medical help and support, and our government should help provide it. We can no longer turn our heads and ignore the problem in our society. Now, more than ever, it is of the utmost importance to get to the root of the problem, find new ways to fix it, and teach later generations that it is acceptable to talk about addiction and ask for help. Removing the stigma associated with addiction is the first place to start. So I have my works cited listed here of all the different sources that I use, the book source, the scholarly journal, news magazine, the web, and the multimodal. I have a couple extras in there too, and I have them all listed. Thanks for watching.